If you have a little bit of work experience in the healthcare industry, I have a couple really good remote jobs for you today. So these jobs don't require a whole lot of experience. They're not nursing, they're not healthcare aides, and you definitely don't need a medical degree. And you can earn anywhere from $21 to over $34 per hour. So enough goofing off, let's jump right into them. So the first job I have is with Talkiatry, and right now they have an opening for a clinical operations coordinator. So this is a full-time remote position. You can do this job anywhere within the United States, and I'm going to scroll down this job lead to show you they're going to pay $21 to $26 per hour, and benefits are included with this job. So Talkiatry is a virtual mental health platform, and in this position you'll coordinate and oversee the entire offboarding process for existing clinicians. That includes conducting meetings with clinicians, reassigning patients to new providers, tracking data, and communicating with impacted patients. You'll support the preparation for clinical leave of absence, including meeting with clinicians, matching patients with temporary providers, and you'll manage and fulfill provider preference requests and help coordinate clinician schedules. You also provide cross-functional support to assist with various care programs as needed. Dive into the provider onboarding process as necessary to ensure incoming clinicians experience a seamless onboarding process, and assist in tracking and maintaining additional team report outs and metrics. So it sounds like you're going to be doing a whole lot of document processing in this job. They'd like you to have a bachelor's degree in healthcare administration, business administration, or a related field, and 1 to 2 years of work experience, ideally in a clinical setting. Now, even though they tell us that's just ideal, that's not required, they would like you to have experience communicating with patients over the phone and knowledge of PCC workflows and daily responsibilities, and PCC stands for Patient Care Coordination. You need to be a great communicator, you're organized, you have attention to detail and strong problem-solving abilities. You're also familiar with Microsoft Office, including Excel, PowerPoint, Outlook, and Teams. And it's a plus you have administrative or front desk experience, and that's just a plus, it's not required. And they prefer you have experience using eClinicalWorks or related EMR systems, and that too is just preferred, not required. So this job pays $21 to $26 per hour. You don't need a whole lot of experience. If you like this job, you can find the direct link in the description area below this video. This is job number 1. So that brings us to our second remote job that doesn't require a whole lot of experience, and this one comes to us from 30 Madison. They're an online platform that provides specialized care and treatment to people with chronic conditions. And the work-from-home job they have available right now is for a payer, credentialing, and contracting associate. So this is a full-time remote position. This job is open to anyone in the United States. However, they do have some location restrictions. So if we take a quick look at their careers page, they tell us here they're not able to hire in a handful of states. So hopefully you do not live in one of the states you see on your screen right now. If you live in any other states not listed, you're good to apply. So they're going to pay between $52,400 and $72,050 per year, which comes to between $25 and $34.63 per hour, and they offer a pretty decent suite of benefits, including an annual $750 vacation stipend and $500 happiness stipend. So that's new to me. I think this is the first time I've ever seen a vacation stipend. So in this job, you'll coordinate and execute provider enrollment from start to finish. That means you'll be responsible for ensuring medical providers are appropriately contracted and credentialed with health plans. You'll provide quality control for the end-to-end provider enrollment process and give internal feedback on the network adequacy. So that means you'll submit, track progress, and follow up on health plan enrollment applications and credentialing processes for the full healthcare professional roster. You'll research payer reimbursement guidelines to ensure 30 Madison's clinical models will be reimbursed, and maintain accurate provider profiles on CAQH and internal databases. So you're going to be doing a whole bunch of data entry in this position. You'll use a variety of portals and tools to efficiently follow up on providers' credentialing status and progress, and provide input on the contracting roadmap based on state-regulated telehealth guidelines and 30 Madison's footprint. You'll handle confidential administrative functions such as writing external correspondence and primary document collection and verification, and give input on how to improve and scale the credentialing process. So it goes without saying you need a little bit of experience in this job, but you don't need a whole lot. They'd like you to have 2 or more years of payer credentialing and contracting experience, and a high level of interpersonal skills to handle sensitive and confidential communications. You're proficient in word processing, spreadsheets, and database and presentation software such as Microsoft Suite, Google Suite, CAQH, those sort of things. You have a general understanding of CMS, health insurance, and provider enrollment. You're detail-oriented, and you have an inclination towards process-oriented solutions. So this one pays $52,400 up to $72,050 per year. If you're interested in this job, you can find the direct link below. This is job number 2. All right, there you go. We just went over 2 really good remote jobs for all of you who have just a little bit of experience in the healthcare industry. Hopefully one of these jobs works out for you. But if you're looking for something part-time, something completely different, check out this video right here. Good luck to all of you who apply. And as always, thank you so much for visiting. And I'll meet you on the next job lead.